Again, we had a very distinguished guest from Belgium, Dr. Joos, from the Ghent University Hospital, and welcome, sir.
Thank you.
Firstly, I want to ask you about the relationship between the Turkish Thoracic Society and the ERS, the past or future projects about.
Yeah.
Can you tell a little bit about it?
Thank you. I have been in the leadership of the European Respiratory Society in the past 4 years and had the pleasure to be the president last year, so I know the past president. In that function, I met very regularly your leadership of Turkish Thoracic Society and also a lot of your members. And what struck me always is that there is a lot of enthusiasm from the Turkish colleagues to work together. So we have changed our membership, and since a few years we have joined membership with national societies, including the Turkish Thoracic Society, and there are 800 of your members, more than 800, are also now member of ERS through an en bloc membership. So you are member of Turkish Thoracic Society and you join the ERS. So we are very glad to that, because it's a very important group of people, and it's also a very active group of people who are taking part of the activities in science and education and advocacy between ERS and national societies.
And how does this relationship, this collaboration between different countries affect the global thoracic health in a good way, I guess? Yeah?
It's very important that we join forces in improving the global lung health. So we have to work at different levels to achieve that. We are working all in our own countries to advance the field, but we are also working together on a European scale, but also on a worldwide scale to improve lung health worldwide, to make every politician and policymaker be aware of the important effects of, for instance, cigarette smoke, of air pollution. So we are doing together forces to reduce the burden of all our respiratory diseases.
Yeah. And what are your expectations about this Congress?
Yeah, I'm very happy to be here in Antalya. You have a very nice Congress site. You have a lot of attendees and a lot of parallel sessions that are covering really the whole spectrum of respiratory diseases. So I think that for the next days everybody will be updated in his or her specific areas. I especially look forward to several sessions on asthma and COPD, because that's the field where I'm working for the moment most in and are doing clinical research in. And I think there is in every field a lot of advancement, and by coming here together it's really not only listening to speakers, but it's also talking to your colleagues, meeting your colleagues and friends, networking. So the important thing of a congress is that it's more than just reading an article which you can find everywhere nowadays, but being at the congress, you meet your colleagues, you can discuss about your expectations, about the difficulties you can face in your practice. So, and by that I think everybody can move forward.
And you will be also lecturing in this Congress?
Yes.
Can you give a little brief information?
Yes, indeed. I will be lecturing on Saturday morning, rather early, at between 8 and 9 o'clock in the morning, and it will be in a session on asthma and COPD, where I will talk, and also the current ERS president, Dr. Mina Gaga, will talk. So I will talk on asthma, and mainly on severe asthma, and how our insights into the different phenotypes of asthma really can help in choosing the right targeted treatment for our patients with the more difficult to treat severe asthma.
For the last, do you have any message to the participants of the Congress?
My message to the participants is you have a fantastic society. You are with a lot of people here, so really join forces to move your field forward, not only here in Turkey respiratory medicine, but I see that a lot of you also are involved in European collaborations. Take opportunity also of the membership of the European Respiratory Society, because we are offering especially to TTS, to your society, we have each year 2 short-term training fellowships that we are giving together with your society to people who want to go to another European country for 1 to 3 months to really learn and research in pulmonary diseases.
Thank you so much for joining us at our studio.
Thank
and
you.
welcome to our country.
It's a pleasure.
Again.
Thank you very much.
Thank you so much.